Welcome back to Behind IVF Clinic Doors. I'm Thelma, your patient advocate, and I visit clinics all across Europe. If you like what I do, be sure to share this video, leave a like and leave a comment. It all helps the channel to grow and to reach more patients who need support finding a clinic. Today we're in beautiful Athens. And we're going to visit a clinic called EmBIO. This is about 20-25 minutes from the airport. And it's a clinic that has been running since 1996 for almost 30 years, and it has helped over 10,000 babies being born. So let's go inside. First impressions. Clean, organized, and very sober colors. This gives you a vibe of a very professional clinic. As you can see, you have a big waiting area, a couple of consultation rooms with very bright natural light, and a wall full of pictures of all the miracles they've been doing for the last almost 3 decades. Here you can see that I'm finally meeting Anna, my patient coordinator. She's the person I've been speaking with by phone or email for months. She opens a folder, asks for my ID documentation, gives me consent forms. The treatment plan she is about to walk me through is mine, individualized, with my name on it. Then she walks me through the whole cycle, stage by stage, fertilization, egg collection, embryo transfer. The vocabulary I've been Googling for months said out loud, slowly, in a language I understand. Then a question: what would I like to do if there's more embryos than the ones that are transferred? She gives me a few options, like to freeze them, to donate to another couple, or to donate them to research. She doesn't push. She just allows me to think about it. And then we proceed to the practical part. My period started yesterday, so tomorrow I have to start the injections. She shows me a schedule and explains to me the dose that I'm about to start, and that a nurse will explain to me how to do the injections itself. Now I know I'll have a vaginal scan and that I will come back to the clinic every couple of days to see how my body is responding to this medication. As we go along with our visit, you can see here a consultation room with an ultrasound machine where you can have a transvaginal scan. And now that I've already had my consultation with my patient coordinator, it is time to meet the man of the moment per se, Dr. Thanos.
Right, at the first consultation we'll take a history, we'll do a vaginal examination along with a vaginal scan. And then we check the cervix, if there are any problems, we ask for cervical smear. And also we check the ovaries and the uterus. The uterus, we check it in order to see if there's any abnormalities like a polyp or like fibroids. And the ovaries, we check them in order to see if there are any cysts, like endometriotic cyst or follicular cyst or any other cyst, right? Or any other pathology that may arise. After that, we do a full analytical hormone profile, and then according to that, for example, we check the AMH to see how the reserve of the ovarian reserve is like, and then according to that, we decide what to do. We also check the sperm count of the partner. And according to all the results that we have, we decide which method we're going to use. We're going to use the natural cycle IVF, the short protocol, the long protocol, any other protocols that we may need. Also, if there's any polyps, we need to do a hysteroscopy prior to the IVF. If there are any big fibroids, we assess them, and then during the consultation, we inform you that we may have to remove it laparoscopically. Usually, the same applies to the cysts. This is what we do, and along with that, then there are my collaborators or my coordinators. Everyone speaks different language, French, Italian, English. Will follow you through step by step. They will be answering you all the questions and all the modalities of the procedures, and then we'll go on from that. We're really very close to the patients, and we're very happy when they're happy and when they get pregnant, and when they leave the unit satisfied and with a baby.
Next, I had the pleasure of speaking with a patient at the clinic, Anna, who agreed to share a few words about her experience at EmBIO. Let's hear what she has to say. How old are you?
I am 40.
40.
And the last year I told, okay, I will give the last chance for me to have my baby, to try to have a baby. And it was 2-3 days before my birthday. I would be 39, and this year with the 40, I have him here.
And with your own eggs?
Yes, and this is really important. So the only thing that I can say to all the women that they will see maybe this video, don't be afraid. Give a chance to your body, give a chance to your dream, and you will do it with the help of Thanos, from Anna, and all the team here, because they are all great.
Small room, big purpose. This is where sperm collection happens, private and full equipped. But it's what comes next that's impressive. A lab packed with cutting-edge technology, all of it working to give patients the best possible chance. Let's check it.
Here is the microscope where we are doing ICSI, intracytoplasmic sperm injection. It's the procedure where we put a sperm into an oocyte. Fertilization, the most important time of our work in the lab. And then the next day we check the fertilization result in the other microscopes, the stereoscopes. Here, where we check if the eggs are fertilized or not for the patients, and then we proceed to the embryo transfer, which happens with catheters like this. The doctor takes the catheters where we load the embryos for the patient and puts them in the uterus of the woman. Other techniques that we do in the lab is the freezing process. My colleague here is doing a freezing of oocytes at this moment. Liquid nitrogen in a small container where we put the embryos. It's been done with vitrification. So we plunge the embryos in the liquid nitrogen. They come in direct contact with the liquid nitrogen, which is safer for them in order not to form crystals, ice crystals. And then we are thawing the embryos that are frozen and that are going to be transferred in the uterus. We are thawing them again in these microscopes. It's a short procedure. We're not doing it now, but about 15 minutes, and then we take them back to the patient. Okay, here are the incubators where we culture the embryos. As you can see, the temperature is 37 degrees. CO2 percentage is at 6 and O2 6 again. So we set the incubators like this so that the embryos are viable and they have the best conditions for their development until they become day 3 embryos or blastocysts. It depends on the patient and it depends on the treatment we use on each patient.
Hey, so EmBIO, that was a fantastic visit, wasn't it? Okay, so EmBIO has nearly 3 decades of experience, and it's led by a doctor that
in 1989 was part of a team that in London was a pioneer in IVF techniques. This is not marketing, this is legacy, this is powerful. And you can feel it everywhere. You feel it around the clinic, you feel it from the consultation to the lab to the team. It is really, really amazing. Speaking to about the team, Dr. Thanos built this clinic, this very clinic, with his wife, Dr. Katrina, which is the lab director, which means this is a family business creating another family or another families. And this is really inspiring, and it touches my heart. It is a beautiful thing. It was a lovely day spent at this clinic. But does this mean that this clinic is for everyone? Well, if you want a clinic that it has everything under the same roof, yes, definitely. They have decades of proven expertise, a complete infrastructure, and a price point that's more accessible than small clinics. So if you want the legacy, the volume, and a team that has been doing this for nearly 3 decades, you should consider EmBIO. Did you like this episode? Let me know in the comments. Give me a like and don't forget to subscribe. And stay around because there's more clinics to visit. Bye!